Hello, my name is Dr. Barbara Rodwin and I'm from the Back to Health Wellness Center in Ottawa, Ontario. This is my friend Fred. He actually has a rib problem and people get these often. If you have a look right there, he has one that's actually shifted out of alignment. This happens so much, I can't believe it. It happens because of sneezing and coughing and colds, and I find allergies do it in people who are asthmatic because the way they breathe all the time, because these ribs, they attach around to the front to your breastbone and they go all the way around to the back and go into the side of your vertebrae. So you can actually see Fred's rib out here as well. Out meaning it's not dislocated, it's shifted out of alignment. In between these ribs run nerves. So when this goes out of alignment, it causes a lot of pain. I've had some patients come in. One, he was actually sent to the Heart Institute because he actually thought he was having a heart attack because of it, and it ended up being his rib out because it was referring into areas down his arm. And once we adjusted it, it was fine. Some other people, it's so painful when you breathe in and out, because the ribs, they act as, when you're breathing, they do this motion, they go in and out, so it's like a pinching motion, and then they do a bucket handle type motion where they go up and down. So if a rib goes out of alignment, it gets stuck and turned, and when you go to breathe, it's like, so you'll either feel it here, you could feel it on the side, or you could feel it into your back, up into here, or even down your arm, because the nerves actually from in between the ribs, some of them refer down your arm. What do we do to actually fix this? It's really easy to fix. In the back area, you lie on your back and I put my hand underneath you and turn over. I'll demonstrate that later for you and show you what it's like. Then if it's on, because Fred's rib is out on the side as well, so we'll have to adjust it on the side. And what we do is usually take this little instrument. It doesn't hurt. It's just a little spring-loaded device called an activator. And Fred would be lying on his back, and I'd take it and adjust these back into alignment. And then we have to get it moving up near the breastbone or sternum, and we'd actually use this to adjust it here too. So often with these, it's more than one rib that's causing problems. It usually takes a couple of treatments. The other problem with it is, as it happens, because you see Fred's shoulder blade is sticking back because of that rib being out. And the issue with it, it causes everything to tighten up down even into here. So we actually sometimes have to adjust the bottom part of the neck to help with that and release all these muscles that are under tension. So I often like to use the active release technique. We have another video on that, so feel free to watch it, what it is. And if you think about elastic bands that have tied knots in themselves, what I'm going to do is shorten them, then lengthen them, and these would be your muscles to release it. If it's really painful and patients are actually finding it difficult to breathe for a couple of treatments, I'll often get them to wear either a rib brace or even these back braces work. So one patient, because she'd fallen and aggravated her rib, I just got her to wear a back brace up here. And you can actually put it on and it helps keep it stabilized for you. And then you can be able to take an ice pack and just tuck this inside to be able to ice it. And that's one of the better things for it. Very difficult for you to do anything for your own rib. You do need to see a chiropractor to get it adjusted to put it back into alignment. Questions? Feel free to email me. I'm now going to demonstrate how to adjust a rib. So on Fred, you saw how it was actually stuck out at the back. So usually the best way to do it, you could either lie on your stomach and I push this way, but I find it better to do it this way, where you cross your arms and I say, could you hold on with one hand, because I'm using this arm to adjust you. And then I take my hand, it's not my fist, because some patients think it is, it's this piece of my hand that I'm using, and then I say, Amanda, could you please breathe in and breathe all the way out. And as I do that, there, and I just adjusted the rib at the back. So the rib is usually out on the side here and on the front too. So actually Amanda's is right there. And I'd be taking this little handy dandy instrument and using it on there. Some patients say, what do you do? I'm punching it back in like that? I'm like, no, it's not punching, it's adjusting it. So it actually restores the movement. And then on the side, I'd be taking it and doing this. And that would be a rib adjustment on one side, and often we have to go over to the other side and do the same thing. Now if I were to adjust the rib on the other side, on her stomach, Amanda, can you lie on your stomach? So I'd take my hand and I'd actually put it right here, and I'd have her breathe in and breathe all the way out. There. You might have even heard that pop. It's a cracking noise. It's not your bone cracking or crunching. It's just air going into the joint capsule. And that's a rib adjustment.